Hi, everyone. Thank you for joining our Live at 5, where we talk about freedom and liberty in the state of California and across the nation. If you can please start a watch party and share this video, we have some very important information to talk about today. My name is Denise. I am one of the co-founders of Freedom Angels, and I am in the San Joaquin County. I'm in San Joaquin County.
Hi guys, my name is Heidi. I'm one of the co-founders of Freedom Angels. I live in the San Francisco Bay Area and specifically Contra Costa County.
Hi, I'm Tara, also co-founder of the Freedom Angels from the Northern Sierra Nevada Mountains of California. Denise?
And hi guys, I'm Dr. Jeff Barke, board certified primary care doctor. I practice right here in beautiful Southern California, and I am excited to be with the Angels tonight.
It's going to be such a great conversation, a conversation that needs to be had with our medical professionals and the community. And thankfully, we have an amazing doctor who has stepped out of the box and has decided to talk about the things that we actually need to talk about. So it's going to be a really great show. Again, please start a watch party and share this in the reopen pages and all of your school pages. This is some information that you are not going to want to miss. So where do we begin?
Well, let's just start. I think everyone out there knows it's, the reopening restrictions and guidelines for schools is what everyone is concerned about, whether you're a parent, a teacher, or a child. Everyone wants to know, what's this going to look like and how can our voice be heard in this process? Dr. Barke, what you've been working on is just incredible, and really the state and the nation have been waiting for this kind of information, this kind of expertise, insight into how to do this. I just want to open the floor to you and tell us what you've been working on and what's coming up.
Well, thank you so much. And of course, I'm sharing this on my Facebook site and my Facebook friends. If you have the opportunity to share and start a watch party, please do. Now, I think many of the people that follow me on Facebook are really interested in who you are. I've been following you for a while as the Freedom Angels, and I'm watching you and I'm watching your broadcasts. I'm watching your activism around this state. And it's been so fascinating to me, and you guys have been so motivating to me to continue to do what I do. Would you mind if we just took a minute so you can share with my Facebook friends and others that are watching, who are the Freedom Angels?
Sure. Well, again, my name is Denise. I started this activism with 276 in California, where they were interfering with the doctor-patient relationship. I was so angry at the way that the legislature was not listening to the people and just making decisions without parental input when it comes to our children. I ended up giving my phone number out publicly on YouTube, and Heidi ended up calling me. So that's how Heidi and I started working together.
And then one day when I was at the Capitol for 276, I happened to walk into a coffee shop, a small little coffee shop. Actually, it's Laboo. It's now famous Laboo. Everybody knows that in Sacramento. And in walks Bobby Kennedy with Tara. And that was our chance meeting where we connected. I'd already been working with Stephanie a little bit prior on some homeschooling legislation years prior. I'd been very active in 5G and EMF issues in my community. So I already had some experience there, but it was like the perfect meeting together through 276. Tara, do you want to add to that?
And Tara, tell everybody what 276 is. You guys speak it fluently, and you know what it is, and I'm sure your audience does. My audience may not know what that is. What is 276?
It was, SB 276 was a bill introduced last year in California, and it was meant to narrow the guidelines on a medical exemption to vaccination for daycare, preschool, K through 12, private, public. It was really set up to remove the doctor-patient relationship, put it in the hands of the state, and narrow the guidelines to a standard of care so narrow that functionally nobody qualified. It really took the doctor's discretion and the patient's unique medical condition and moment in time out of the equation. And it also instituted a database, a tracking database in the state. So
You know, that's a perfect lead in, because as a matter of fact, just today, as we discussed earlier, I'm about to launch a brand new charter school in the city of Orange called Orange County Classical Academy. And it's going to be the first free public classical education charter school in Orange County, and the only one in California using Hillsdale College's K through 12 curriculum. And just today I had a conversation with a prospective parent who signed up to send their, I think it's an 11-year-old, to our school. And they were concerned that they have an exemption, and they wanted to know whether that vaccination exemption would be valid in transferring it to our school. And we did a little research and back and forth and so forth. And sure enough, this exemption that she has for her son will be valid. And so she was excited about that. You know, I haven't gotten involved a lot in the vaccination world of concern, but I can tell you this. I recently joined an organization called Physicians for Informed Consent. And what that organization is really about is the concept of that parents should be making the decisions for their child with informed consent, that the government should not be mandating a medical procedure for anyone. Now, I'm not an anti-vax person. I think vaccinations have a role to play, and mostly that they're good. But if they're good, and I think they are, we should be educating families and parents, and we should be encouraging them to use vaccinations. We should never be mandating from a government perspective that regardless of the parents' wishes, regardless of the individual situation for each child and their medical history and so forth, that somehow they should be getting a medical procedure against their will, and that should be a requirement for entry into a government-run school. So I think that's just wrong. And actually, this was a homeschool parent, and the reason why they were homeschooling was mainly because of the vaccine requirements, that they believed, and they had good reason to believe, that their child should be exempt from vaccinations, strong family history of vaccine injury and immunodeficiency problems and so forth. And that was the reason why they were choosing to homeschool. And now they're going to be coming back to public education and joining our charter school. So we're really excited by that.
Yeah.
That's awesome.
You know,
We've had, honestly, we're not anti-vaxxers. We vaccinated our children, and we saw that there was a reaction. There was something happening to our kids. So we have went to our doctors, and our doctors also, along with us, gave us the advice, maybe this isn't the best form of action. And with 276, it really interfered with that decision, putting that decision in the hands of public health and our state leaders. So, you know, when people say, you know, you're anti-vaxxers, we are not anti-vaxxers. We vaccinated our children. However, we do believe in the freedom for parents to choose whichever medical procedures fit their family without being coerced and bullied into into that procedure. I mean, that's really what we stand for: freedom for all, liberty for all. And I appreciate you coming out and saying that, you know, we do not want government interfering in our children's health and our health.
You know, it's interesting to me that any other medical procedure that I perform, so I don't know, if you came in and you had a mole on your arm that was suspicious and I was going to take that mole off because we were worried, I would have a lengthy discussion with you about the benefits of doing that, about what the risks of doing that would be, from scarring to infection, pain, and so forth. And then I would have you sign a piece of paper that indicated that you understood the risks and benefits and you were giving informed consent for me to perform this procedure. With vaccinations, we don't do that. So if you came into my office and you wanted a vaccination, an updated tetanus shot, an annual flu shot, measles, mumps, rubella shot, you name it, there is no necessity for me to have you sign any kind of informed consent. And if you took that package insert from any of those vaccinations and literally open that thing up, it would be in almost 6 to 8 point font. So you'd need even reading glasses to be able to read the thing. And you read through there and you saw the various studies that were done and the potential risks and so forth. I'm not sure that many people would have the same opinions about vaccinations after receiving informed consent. And I'm all for informed consent. I'm a pro-vaccination person, but I don't think it's right that we force somebody to get a vaccination without their proper consent. And then we, what's the right word? We indemnify all the vaccination companies. So if there were an adverse reaction, and I've seen it, I've got a picture, Caitlin, if you're on, I won't mention your last name, sent me a picture of her child following vaccination with welts all over her body, ended up in the emergency department, and reason enough not to give her the next series of that vaccination. And she really has no recourse, certainly no recourse against the vaccination company. The only recourse is this pool of money that was sent aside that people that are harmed from vaccinations can appeal to, and depending on their claim can get payout. But from a liability standpoint, I think it was during the Reagan administration that the vaccination companies were exempted from any liability. And I don't think that's right either. Again, I'm not anti-vax. I am for informed consent, and I'm against government mandating a procedure, a medical procedure on a patient.
Yeah, the calling someone anti-vax is really just a way to shut down the conversation and to, be able to discredit them, when really, what people are parents who are concerned and have ended up, like how we say, is like, gosh, we've been pushed into the space where we've become big industry watchdogs. We're big pharma watchdogs. We're big tech watchdogs saying, don't put our kids' medical records in a database. We want liability. We want checks and balances. We want safety studies, and we want body sovereignty. We want the right to parent our children, to be able to make decisions with our doctors for our bodies. And we have protected human and constitutional rights. That's literally what we're saying. And when you frame it that way, everyone goes, oh, I'm on that side. So, there's interest in making it look like something else other than what it really is.
Absolutely. And then unfortunately, what's happened now is all the social media platforms have banned any anti-vaccination information, even if it's talking about what are the risks and what are the benefits. If there's anything that leans into the direction of being critical of vaccinations, you are banned from Facebook, you are banned from YouTube. And I don't think that's right either. I haven't had the opportunity to meet Bobby Kennedy, but I certainly have followed his work, and he's, obviously he's got a name and a family that gives him almost instant credibility. And I certainly appreciate that he has been pushing this effort to get this into the public sphere, to try to look at eliminating exemptions from vaccination companies and pushing towards eliminating mandates and requiring informed consent when we do give kids vaccinations. So I certainly appreciate that effort, and I look forward to at some point having the opportunity to meet him.
Yeah, Children's Health Defense and Robert F. Kennedy Jr. on Instagram are really good at showing the science. That's really, they're experts at that. Plus they have litigation on really the corrupt practices about regulatory agencies and stuff. They're really trying to clean those things up. And I think we're all grateful that they're leading in that space for everybody.
Absolutely. So, that kind of leads into the issue of schools have been locked down, ended, a couple months early. And I think that was a huge mistake, closing down all the schools because of COVID-19. And now we're entering the summer, and we're starting into the season when we're scratching our head and we're trying to decide, how are we going to open up our schools again? And there's a lot of guidelines coming out in California. We've got the CDC that came out with guidelines. The California Department of Education has come out with guidelines. And locally in Orange County, the Orange County Board of Education is putting together a panel of experts to review this issue and then ultimately come out with their own guidelines. As I mentioned before, I'm starting a charter school, and we're opening on August 13th. And the co-founder and I and the folks that are involved in this charter school, we've put our heads together and tried to look at best practices and decide what made sense, both from a scientific standpoint and then just a common sense standpoint. And what we've decided is that we're going to be opening our school on August 13th with very limited restrictions. So there will be no requirement for the children to wear masks. I think not only is that not effective, it is supported by the science that it's not helpful. And in some regards, it can actually be harmful to children to require them to have masks on. We're not going to require social distancing of the children. And that is just so obvious to me that that's the right thing to do. And the reason why is in Orange County, California, you can literally count on one hand. Actually, you don't even need a hand to count the number of kids that have died from COVID-19, because that number is exactly 0. And across the nation, if you look at the CDC site, and don't believe me, go onto the CDC website. It's not a bad site to play around and look at the statistics. The number of kids that have died from COVID-19 has been somewhere around 20, and you can calculate other risks. So a child has a 50 times greater risk of dying in a swimming pool or dying from drowning than they do from COVID-19, and a far greater risk of dying in an automobile accident on the way to school than dying from COVID-19. So forcing a child to either wear a mask or to socially distance, or to reduce the census of the classroom so kids can only learn part-time, makes 0 sense at all. And we've already hurt the kids enough by closing down schools a couple months early. We've interfered with their education. I think it's time that we open up schools with very limited restrictions and allow kids to be kids and stop living our lives with fear. The only restrictions we're gonna have, and they're common sense, is that we'll take temperatures as kids, staff, and teachers arrive at school. Obviously, if anybody is sick, we will send them home and ask them not to come to school. We will do good hygiene, so hand washing, sanitizer availability, and certainly doing a good job in cleaning up the class every single night and the classrooms as often as we can. So those are some common sense things that I believe is the right path forward for other school districts to open. I've spoken to some school board members from traditional government schools, and they're going through all kinds of machinations to try to figure it out. And part of the issue is you have some of the most powerful unions in the country, the California Teachers Association, the American Federation of Teachers, the National Education Association, and they're overplaying their hand, in my opinion, being consistent with some of the CDC guidelines that is recommending masks on children. Can you imagine a first or second grader having a mask on their face or a face covering? I mean, that's just ridiculous. Not only is it not helpful, but I think it's harmful. And many of the other CDC guidelines just make no sense at all. And so we are at least relieved that so far these various bodies, CDC and others, have come out with guidelines, not mandates. And we hope it stays that way. That's the way it should be. It should be local control in local schools, driven by local governance and what the parents and children want in those local school districts. So that's what we're hoping for. We've got about 2 months to go before we open, and we'll see what happens.
So Dr. Barke, there's this big misconception as we go out and about. You know, I'm in the Bay Area, which is the heart of the technocracy. We were the first to get locked down. We're still under tyrannical.
My condolences.
Yeah, it's so bad. And as I go out and about, people just say over and over again, but the CDC mandates, but the public health officer mandates, but so-and-so mandates. Can you please speak to that? Or that it's law?
First of all, they're not mandates. They're just guidelines. The CDC really has no authority to mandate anything. It would have to be the governor of California and the legislature, not the CDC. Even the California Department of Education has no legal authority to mandate anything. So so far, their recommendations are just that, recommendations and guidelines, and not mandates or laws that we have to follow. And we are hoping that it stays that way, because I think there'll be a revolt if they take the CDC guidelines and turn them into mandates. And to be quite frank, you know, I'm conflicted on this, because on the one hand, I'm acutely aware of what goes on behind the classroom doors and in some of these public schools. As I may have shared with you earlier, I served on a school board, Los Alamitos Unified School Board, for 12 years as an elected school board member. And we're considered Los Alamitos is considered one of the best school districts in all of Orange County. And rightfully we are by scores and programs and things that we do. But even in a school like Los Al, we've got 45% of our kids at the high school that are below grade level in math. And that's one of the best school districts in the country. If you look at all of California, we see about 60% of all California school children are below grade level in math, and very similar numbers in ELA, English Language Arts. So it's hard to argue by any measure that California schools, and this is happening all over the country, are doing our children right. They're failing by academic standards, they're failing by indoctrination. And then of course in California, we've got this crazy law that was passed a few years ago that's most commonly referred to as CHIA, the California Healthy Youth Act, which is basically sex ed that's mandated in middle school and in high school. And if you look at some of the curriculum, even the more moderate commercially available curriculum is quite pornographic, age and medically inappropriate, and very difficult for parents to opt out. Now, us as a charter school, we're a public school, will be required also in middle school and high school to fulfill that California Healthy Youth Act requirement, but we're gonna go about it in a whole different way. There's a group of parents in Orange County that created our own curriculum. There's no mandate that we must purchase the curriculum from a commercial provider. So we created our own curriculum. I was invited to give my medical opinion in reviewing it to make sure that it was medically accurate and age appropriate. And so our curriculum is California compliant and fairly benign. There's no pornography in it. There's no crazy descriptions about sexual positions and behavior in it. So I think it's fairly benign. So what we're gonna do is we'll take literally the hard copy of the curriculum, we'll give that to every parent when it comes time. And on top of that will be an opt-out form. So if any of those parents find any of the curriculum that's within our curriculum handout objectionable, we will encourage them to opt out, and we'll make it ridiculously easy for them to opt out. Now, what the law also says is we're not allowed to have an opt-in. That's what a lot of parents argued for. And we even argued because some of the school districts are now choosing to take that middle school curriculum, and even though it's not mandated, to teach this stuff in elementary school as well. And there was a group that went up to Sacramento and rallied and encouraged the legislatures to at least say, if they're going to use this curriculum in elementary school, that at least make that elementary school information an opt-in. And of course, you know, the supermajority in Sacramento said, no, we're not going to do that. So we'll make it easy for parents to opt out. Now, I think when they look at our curriculum, they're going to realize that it's fairly benign and they probably won't want to opt out, but we certainly will allow them and encourage them to do so if there's anything in there that they find is objectionable.
We would love to receive a copy of that curriculum as well. I have been on the front lines in my school district as well. I'm a homeschooling mom, so this doesn't affect me at all, but it does affect me because my children still interact with all the children in the community. I don't cloister my homeschool kids away only in my home. They need to be engaging and interacting in the community, and I don't want the kids in my community to be indoctrinated by this horrific, medically inaccurate program. I spoke about the 5th grade curriculum specifically at a school board meeting and pointed out how medically inaccurate it was. And they just thought it was okay and didn't even seem to bother or be concerned about the fact of it. So I would love to get this curriculum and share it with others who homeschool or, you know, want to bring this to their school district or their school. I think that would be wonderful.
Absolutely. Yeah, I'd be happy to share it with you. And by the way, unlike these commercial providers of this curriculum will be free. So there'll be no charge for it. It's a nonprofit organization that has created it. The curriculum is called, it's called HEART, and that stands for, I can't remember, health education and relationship training, I think. And so when it comes time, we'll use that and we'll make it available. And you know, the reality is this is the reason why people are homeschooling their kids, this and others. But you have the California Healthy Youth Act that parents have said, enough, I'm not going to do it. And then you have the vaccination policy and parents are saying, you know, no way, I don't believe in that. And as a result, because of the California Teachers Association, the supermajority up in Sacramento, a lot of parents are choosing alternatives for their kids. And that's a good thing. So that's why I have conflict with, you know, I'm anxious to get the schools open and I want them to open appropriately with some recommendations like we're using. On the other hand, I'm really hopeful that more parents will continue to homeschool their kids or look for alternatives, either good charter schools that believe what they believe, or private schools if they can afford it, and keep their kids out of traditional government schools that almost by any measure is failing way too many kids.
Well, we agree with you completely on all of it. And we should do a separate show at some point just on the sex ed in schools, because we all feel the same way. And we're so grateful that you're coming up with a model, again, something that can be shared. Because one of the, we talked about the silver linings of the coronavirus pandemic, being that people will seek alternatives, but also those that are part of the, let's call it the failed school system. And it's not just public. Overall, there needs to be a rebuilding and retooling of the entire way we educate children in this nation. This is an opportunity where parents have never been more engaged, where they've been forced into a situation where they're demanding inclusion in the process. They want their voices heard. And that's the time that we can help provide these models of to help them to actually rework and change the whole conversation. Do you want to talk a little bit more about, you mentioned the county Department of Education or Board of Education in Orange County. Could you talk a little bit more about that? You were saying an expert panel.
Sure. So the county board decided that they want to be able to give guidance to districts about how to properly open. So they put together an expert panel to discuss this issue. And the idea is that they want to create a white paper, if you will, a guidance paper that districts can use as they make decisions about how to open. So we've got a variety of physicians on the panel. We've got an infectious disease doctor from Orange County. We've got a pediatrician from Orange County. We have an emergency room physician. We have a hospitalist, and we have some public policy people. So there's a public policy expert out of the School of Public Policy at Pepperdine University. And we have a public policy expert from Chapman University. And then just confirmed today is the newly appointed public health care leader in Orange County, and I can't remember his name, and he'll be joining us as well. So a total of about 10 experts. It will be open and transparent to the public. We think it's really important when you come out with guidelines and policies, especially as a government agency with elected government leaders, that it's important that the process be transparent to the public. And the superintendent of the Orange County Department of Education is also an elected official. So it's an interesting dynamic. You have 5 elected board members and you have 1 elected superintendent, and they often conflict. So the county superintendent has decided to create his own guideline panel, but it's being done behind closed doors. So the public has not been invited. The experts are not publicly listed. Even the county elected school board members asked to be part of this, and they were denied access to be part of it. They were denied access even to listen in. So they wanted to listen in because some of it was on Zoom. Obviously, they couldn't all get together. And they said, listen, we won't participate, but I just want to hear the deliberations so I can understand what's going on, the thinking process, and whatever product they come up with, it'll make more sense in the context of hearing the banter and the back and forth and the questions. But the county elected superintendent refused any transparency. So he's doing this all behind closed doors without any public input. There's no public that can view it. There's no questions from the public. So the county board members decided that the best way to do this is with full transparency from their constituency, because they were elected by the people and they want the people to be involved. So there'll be questions from the public. The public can either Zoom or attend in person to hear firsthand the information from the experts and hear the questions that are posed to the experts by the board members. And we think then and only then can good quality public guidelines be made that will be accepted as reasonable and worthy of consideration and worthy to follow, as opposed to something that's done behind closed doors where there is no input from the public, and deliberations and comments and discussions are not allowed to be viewed.
Wow, I can't even say how grateful we are for the County Board of Education that is, course working on it that way, because this is all that any parent or has been asking for. It's all transparency, inclusion, real honest conversation, really looking at all the pieces and having a transparent, honest conversation around it to get to the the decisions. So that's next. When did you say that was?
It's June 24th, and it will be from 6:30 to 9:30 p.m. Pacific Standard Time. And I'm assuming, how do you get the Zoom link? I assume you could go onto the County Board of Education website, and there'll be some information on there and a link where you can click on to join, or you could physically show up to the County Board of Education boardroom. The problem is, the boardroom is relatively small, and there will be social distancing. So not sure how much room there'll be for the public. And I hate for somebody to show up only to be turned away or have to stand outside and listen to it on a speaker or what have you. So whether it's Zoom or you show up in person, it will be transparent and open to all to view. And I think that's important. Even the CDC guidelines, the Centers for Disease Control is thought of as a reputable organization, and certainly they are. But there's no transparency in how they came about their guidelines. There's no list of experts that were consulted or discussed and deliberated and then came up with the guidelines. And the same thing with the California Department of Education. There was no public input and meetings and so forth. They just put these guidelines out, a bunch of overpaid bureaucrats, doing things behind closed doors, and then expecting the public just to take this and use it as they see fit. And I think that's wrong. It's high time that we, the people, start running our country again and not allow the bureaucrats to run our country. The speech I gave a couple months back that allowed me to have this somewhat national voice and ultimately led me to find the FreedomAngels. I held up a copy of the Constitution. I made a comment something like, the Constitution was never designed for the government to restrict the freedoms and liberties of we the people. That Constitution was designed to limit the scope and power of the government, the federal government, by we the people. And it seems to me, especially of late, we've got it all backwards, that the heavy hand of the federal and state governments are demanding things on us that seem arbitrary and capricious. This national lockdown of states, actually it was done by individual governors, I think was a way overreach, and it has caused tremendous harm. And I don't mean just to our economy. I've heard people say, well, one death, you can always make up money, but you can't make up a death. But here's the problem, and a lot of people don't realize this, is along with the economic shutdown of our economy also came a shutdown of the entire medical field across the country. So I spoke to a psychiatrist recently. Actually, he's going to be on our panel. His name is Mark McDonald, board certified adolescent pediatric psychiatrist. And he shared with me that his volume was down close to 80% during the lockdown. And these are kids and young adults that need his help, that need to be checked on medication, that need encouragement and counseling just to survive. And he reported also that his prescriptions for benzodiazepines, that's Valium and Xanax and Ativan and others, were the highest in his entire career during this lockdown, because he didn't see any other option to help some of these young adults and kids with panic and anxiety and so forth. And this is but one psychiatrist. And multiply that by, I don't know how many psychiatrists there are in the country, but 10,000 maybe, or whatever the number is. And then you pick your field, and the same thing was happening. There was an article out of Ontario, Canada. I think it was 15 or 20 people died waiting for an elective cardiac procedure because their procedure was deemed non-essential. And the non-essential nature of it was a bit arbitrary. And gastroenterologists that stopped doing screening colonoscopies and missing colon cancer and polyps, women that were unable to go in and get their annual mammogram or screening for cervical cancer with pap smears, and on and on and on and on. And so now we're seeing the harm as a result of this. There is literally, the suicide rate is the highest it's ever been since the Great Depression. And I am absolutely convinced that there was more harm done by the shutdown than harm done by the actual COVID-19 virus.
Yeah.
Absolutely. I mean,
that's what I was going to say. Could you address the public health officers and how they are choosing over and over again? They're refusing to course correct in California. Do you have anything to say about that? Because many of them are medical doctors just like yourself, but they seem to be operating differently.
And many of them are not medical doctors. They're government bureaucrats. And they're unfortunately a political officer more than a health officer. And some of those guidelines and their actions are being driven by politics, not by science. And it's very unfortunate. And we've seen that here in Orange County. I was part of a protest a while back in Huntington Beach, demanding that the County Board of Education, not the Board of Education, the county supervisors and our governor allow Orange County businesses to open up. Because the reality is that COVID-19, about 50% of the deaths in COVID-19 has been in nursing home patients and extended care facilities. So 50% of the deaths have occurred in 0.6% of the population. And just let that sink in for a minute. 50% of the deaths in 0.6% of the population. So this virus is almost entirely a virus that wreaks havoc in the older population and those with significant underlying medical conditions. And so young people and healthy people have very little to worry about this virus. We were initially told that we wanted to flatten the curve in order to preserve capacity in various healthcare systems, in New York in particular, New Jersey for a time, and even Seattle. But the problem is, when in flattening the curve, all we're doing is temporarily delaying the number of deaths. Those people that are going to die are still going to die, but just at a different date, because we don't have a vaccination. We all know that we can't keep our economy locked up forever and until a vaccination comes along. So there will be people that will continue to be adversely affected, almost entirely older people and those with pre-existing conditions. So what a healthy society really ought to do, and has done in the past, is you take the most vulnerable and you protect them. And people that are sick, those are the ones that you isolate and quarantine. You don't take the healthy herd, the young and the children, and you lock them up in the house. That's a mistake, and we've made a big mistake. And I think looking back, historians will write 10 or 15 or 20 years from now that this was one of the greatest mistakes ever made in human history. And the misery that was caused as a result of this mistake will be long lasting. There's examples where these mistakes weren't made, by the way. I think there's 9 states that did not lock down. Of course, all 9 states have Republican governors, so they think about things like liberty and freedom, not just safety and health measures. And those states are doing just fine. You have Sweden that chose a different path as well. They did not lock down their whole country. Yes, their curves rose quicker than ours because they didn't lock down the country, but now they're coming out of it. They're doing fine. They haven't caused economic disaster, and they haven't caused a healthcare crisis as well by the decisions of individual governors like we've had here in the country. So I'm optimistic moving forward that we can turn this around. I'm optimistic that we can open schools safely. I'm hoping that parents will have now seen the light on another level. We've got the sex ed thing, we've got the vaccination thing, we've got some of the ridiculous rules in how some school districts are gonna open. And I hope this wakes up more freedom angels to take charge of their own lives and their kids' lives and make best decisions for them and not just be ruled by the heavy hand of government bureaucracy.
yeah, amen to that. I wanted to say, you talked about protecting the most vulnerable. That's what we should be doing and focusing on. We've been talking about that for a long time. I'd love to hear some of your stories and experiences around, like, our point is the way you protect the most vulnerable is you make sure that they're the healthiest they can be, and that they, at the earliest point of contact, they're given the best treatments and the best medical care and treatments available. And we know that hydroxychloroquine has been particularly politicized, which is honestly criminal. Would you explain some of your experience for people around that?
Well, you're absolutely right. And what I wouldn't do to protect the elderly is take recovering COVID patients and sending them to nursing homes like Governor Cuomo did in New York. And then he complained about it, that somehow that was forced on him from the federal government, which is absolutely wrong, because other governors did not make that same mistake. And unfortunately, as a result, there were thousands and thousands of nursing home patients that succumbed to COVID-19. And that's unfortunate. So the way we protect the elderly, most importantly, is we need to get to some level of herd immunity. And what herd immunity is when a certain percentage of the population develop protective antibodies, then the virus can no longer skip around and infect the people that are most vulnerable. And older people might remember, because I remember, I'm not that old, but I remember when I was a kid, and chickenpox came through the town. My mom took me down the street to a friend's house that had chickenpox. I don't know how old I was. I must have been 6 or 7 or 8. I don't even remember. I'd have to ask my mom. She's probably watching right now. I texted her. She's probably on the line. Mom, if you're there, how old were we when you shared chickenpox with Ron, my brother, and Andy, my sister, and I? And we all got it and took oatmeal baths and calamine lotion and so forth. So that's what we did before we had vaccinations, is we would expose people to a mild illness and allow them to recover. And then we had immunity, long-lasting immunity, and the virus could no longer skip and go into adults and hurt us as we got older. And so similarly, we know that children are relatively immune to this virus. We know that about 98.6% of people, when they get this virus, will either have no symptoms or will have mild symptoms, and especially in the young. So there's no reason to fear this. And if kids and young adults are exposed, they should do just fine. And now they'll have immunity that ultimately will protect the older adults. And I think that's the path forward, not waiting for some vaccination that we may or may not get. There's talk about a vaccination before the end of the year. I just don't see it coming. I think the earliest we could expect it would be about this time next year. I mean, the reality is typical vaccinations, if we're successful in even making one, we still don't have a vaccination for HIV, right? We've been working on that for I don't know how many years. And there's other viruses we don't have vaccinations for as well. But the earliest we can expect a vaccination normally is 3 to 5 years. But we're pushing things along, and maybe medical researchers will come to the time where we'll get one early, and hopefully it'll be a safe vaccination and it'll be effective. But there is effective treatment now, especially when we treat early with mild symptoms. So literally just today, we all were talking on the phone, and while we were talking on the phone, a patient of mine was just leaving the office. He was exposed to COVID-19. He came in today to be tested. He does not have COVID-19 himself, but he's still in this window where he could turn positive. So what we've done is we put him on a preventative dose of hydroxychloroquine. Now remember, hydroxychloroquine and zinc, but hydroxychloroquine has been around since the late 1950s. It's used by millions and millions of people around the world routinely daily for rheumatoid arthritis, systemic lupus, and other autoimmune diseases quite safely. And the dose for those illnesses is very similar to the doses for treatment. So for him, I put him on a very low dose, 200 milligrams once a day for a week, and then once a week. Has a very long half-life. I use hydroxychloroquine also routinely for malaria prevention. So if you were going, say, to Africa to check out the game parks, and you were there in a time of year where there's malaria, hydroxychloroquine is one of the options. You'd start it once a week, a couple weeks before you go, continue taking it once a week, and when you get home, you'd stay on it for a few more weeks, 1 pill per week. And it's very effective because it has such a long half-life. Very safe, very effective, and incredibly cheap. But for the first time in my career, I've been practicing medicine for over 30 years. For the very first time in my career, I am called by pharmacists and I'm challenged on my prescription for a drug that's safe, effective, and cheap. I'm asked, why am I prescribing it? Does a patient have proof of being COVID-19 positive? What scientific evidence am I using to prescribe this drug? And I've never seen anything like it. Why is this suddenly political? My decision that I make in the privacy of my exam room with informed consent with my patient, I just don't get it. And it's crazy. I've never seen medicine politicized the way it's been now. But so for COVID-19, most importantly is that you keep yourself healthy. So we know a strong immune system is very important, and you can do that by eating really clean, taking some supplements. Like I'm a big fan right now, taking things like fish oil, vitamin D, vitamin C, and zinc. Magnesium, I think, is a good choice as well, just to boost your immune system. So if you do come in contact with this virus, you'll be in better position. You know, nothing's more important also than making sure you're staying physically fit, keeping your weight down. If you do have pre-existing conditions, get in and see your doctor and get those addressed. So treating early with mild symptoms is very effective. The other patient is a patient who saw me on Instagram, of all things. He lives in Mission Viejo, and he called me up. And he's been sick now for 11 days with COVID-19, 60-year-old man, sick for 11 days. His local doctor refused, even though he asked, to put him on hydroxychloroquine. So he has been taking zinc and vitamin C, but no prescription medication. And he's getting worse and worse and worse. And he called me today because he was scared to go to the emergency department because he was starting to have chest pain and difficulty breathing and so forth. By the time we communicated and by the time we were scheduling a time for him to come in and ultimately be my patient, his wife drove him to the emergency department, and he's being admitted to the hospital now. And personally, I think that's a form of malpractice, if you will, because I believe that had he been treated early with his mild symptoms, it's like it's much easier to put out a really small fire than wait until there's a giant bonfire that you have to put out. And I think that's what's happening with him. And I'll follow up and see how he's doing. But unfortunately, he did not have the benefit of early treatment for his mild symptoms.
Yeah, I mean, honestly, I find that, heartbreaking and criminal. We know that there's Governor Sisolak of Nevada. He's a Democratic governor, and he made it political early on. He didn't allow doctors to prescribe it at their office. He said you could, not even at the ER, not at the doctor's office, not at the ER, you could only get it if you became an admitted patient for COVID. Again, blocking the ability to give best treatments, whatever they may be, early on is just not what an enlightened society does. That is not how you should be handling people's best care and wellness.
And a nurse just contacted me in Contra Costa County just within this last week. Hydroxychloroquine was politicized. It was removed off the table. So she had a patient that came in that it would have been the perfect treatment, and she is not allowed to administer this drug that she knows will work. This is on my county public health officer's hands because he is this is what he should be doing right now, is making sure that the right therapeutics are available, but instead he's refusing to play this political game. And so I don't know if you know, but we've gone to his house twice now to protest in front of it, because that's how serious this is. This is crimes against humanity, and it's not a game. I mean, people think that we've crossed a line by showing up there, but we've shown over and over again that the process is broken and something has to give immediately. Course correction must happen.
Yeah, you're right. So I can prescribe OxyContin if I want without harassment, but God forbid I should prescribe a drug that's been around since the beginning of time, has been proven safe and cheap. That's what I get harassed for. Just to give you an example of how political this has become, one of the most reputable and highly regarded medical journals, The Lancet out of Great Britain, published a critical piece on hydroxychloroquine. And shortly thereafter, some researchers kind of looked under the hood at the study and what they've done and found all kinds of flaws in their study. And ultimately, The Lancet was forced to retract the article being negative on hydroxychloroquine. And this has happened to other major publications as well. They're so set on being political with this drug. And we all know why. It's because a couple months ago, President Trump made mention of it at a press conference. I remember I was driving to work, literally down PCH, listening to the press conference. You know, they were on every day, Anthony Fauci, President Trump and company. And sure enough, I remember President Trump making some mention to hydroxychloroquine. I was about 10 minutes from the office, and I'm thinking, I wonder if I'm going to get to the office before one of my patients texts me or emails me with a question about hydroxychloroquine. As I was pulling into the parking lot, sure enough, I got a text message from a patient asking about hydroxychloroquine, and then it was game on with the politics of medicine, and it's very unfortunate that that happened.
Yeah, it really is unfortunate, and it really shows that there's a lot of disingenuous actions going on, because it's just not right to politicize medicine like that. It's just not.
Absolutely.
You know, we would love to go back and just kind of recap on what, you know, the model that you're building for your charter school. Thank you so much for that. I mean, and as you get more documents on it available, we will make sure that we share that through, because we want any viewers to know that no matter where you are, whether you're in Orange County or you're in California or you're in any state of this nation, you know, we're going to try to spread the information that's coming out of Orange County from the County Board of Education's expert hearing next week, what you're doing with your charter school, because you're providing things that really other communities need desperately, and parents and other, you know, elected and appointed officials as well may not have gotten as far in the process as you have, and they don't have to reinvent the wheel. Parents and teachers can take this to them and show them a model of what's been done and all the back end behind the reasoning for it, and then recreate it in their own and push for it in their own community.
Yeah, absolutely. So maybe what we can do is after the County Board of Education meets next week, we can get back together and, or, you know, if you go on Zoom for the County Board meeting, maybe you can, there's probably a way you can share that on your social media. That would be interesting to do. And by the way, if anybody's listening in the Orange County area, orangecountyclassicalacademy.org, we still have some capacity. We're starting K through 5, 2 classes each grade. And we're going to add a grade every year until we're K through 12. So we're super excited. So if you're a parent that's listening and you've got a TK through 5th grader and you're interested in a different approach to education, a more holistic approach, the way I like to describe it is homeschool values in a traditional setting. And so if you're interested, go online and you can register and contact me there. And then I look forward to getting back together with the Angels after the county board meets, and we'll talk about guidelines for opening the schools.
Dr. Barke, there was a question that came up. I know there's homeschoolers up here in Northern California and probably across the country watching right now. Will you consider doing a homeschool satellite program out of your charter school at some point?
Unfortunately, we can't. That's not what our petition allows us to do. I think it's a wonderful idea. We're not prepared to do that. We're not allowed to do that. We are chartered by the Orange Unified School District, and it was an arduous process to get the Orange Unified School Board, at least 4 of the 7 board members, to approve our charter unconditionally for 5 years. So we have to stay pretty close to our chartering petition, and that doesn't include a homeschool or a distance learning component. But certainly if you're in the Orange County area, we'd love to have you contact us. And you don't have to be a resident of Orange County. You just have to be able to get to our school. We even have a couple families, I think, in the Pasadena area. That's, I don't know, maybe 40, 50 miles away. And they're going to carpool and bring their kids to our school. So we're really excited to have people from all over Orange County and beyond that are excited to see our model and help us grow and be successful.
Yeah, that's great that you don't even have to be from Orange County to be able to attend. We will definitely share all the pieces about your charter school and what comes out of the County Board of Education hearing. I'm honestly, if anyone's listening to this, no matter where you are, what county, what state, we need to see thousands of shares of that Zoom meeting of next Wednesdays. I don't think we can overstate the importance of having a transparent and honest discussion with a panel of experts to really set forth reasonable guidelines for reopening our schools. This is something everyone's been craving and needing, and it's the right moment in time. So share this, tag, make sure every person you know involved in education who has a kid in it or is involved in the administration of it is tagged and like seeing that, you know, participating on that Zoom. Let's make that the most watched Zoom in the history of like America.
That'd be great. I love it. And so, you know, I know we've been going about an hour. I don't want to take too much of your time. And I just wanted to thank the Freedom Angels for inviting me on your show. It is such an honor. I'm such an admirer of the work that you're doing. Keep up the great work, and hopefully we can continue to work together because we got a country to save.
We absolutely do. And my apologies, Denise was getting a tremendous migraine. So guys, that's why Denise fell off the live. So hopefully she's getting some rest right now. And as we're closing, we just wanted to let you guys know that your watch parties, your shares make a difference for us. Our website is freedomangelsfoundation.org, which links to all of our social media. I've been watching the comments, and it says that Facebook is not happy with the content, and the sound is going down, the feed is buffering constantly. So just so you guys know, we have been recording this. We are going to upload it to our YouTube channel. We're going to upload it to our website. We're going to make sure, and we know, actually, Dr. Barke, why don't you share your social media handles so our viewers can go to your channels as well? You know,
as a matter of fact, I was just renaming it so people could see. So my daughter Allie created an Instagram handle for me, and it's Prescription for Liberty, RX4FOR Liberty, and same thing on Twitter, RX_for Liberty, or you can follow me, of course, on Facebook, and that's just under my name, Jeffrey, Jeffrey Barke. Come support us and follow us and spread the word, because this is, this is important. We've got our kids to save and our country to save, and we really need to turn this ship around and maximize liberty and freedom over government tyranny.
Absolutely. Well, thank you very much. We will be in touch. We'll see you next time.
All right, I'll see you next time, Angels. Thanks so much.
And thank you. And yeah, everybody, this is the one to share, and keep an eye on watch, because we're going to spread what's coming out of Orange County, and what it's really some models that we can all use. And we know everybody is desperate to find real solutions out of this mess we're in. So thanks for doing that, Dr. Barke, for being part of that. And we'll keep sharing it and share this wide and far. And we'll talk soon. Thank you.
Bye.
Bye-bye.
Bye. Oh, Heidi.